Okay, we're going to look at whether or not nitric oxide supplementation can be used in resistance and endurance training to improve performance metrics. So what is nitric oxide? This is a molecule involved in the regulation of vasodilation, blood flow, cellular calcium, neurotransmission, mitochondrial respiration, and platelet function. So lots of different things that it's involved in. It's produced endogenously. However, NO precursors can be administered exogenously. And NO is produced primarily in two different pathways, the NO synthase dependent pathway as well as the NO synthase independent pathway. In the dependent pathway, acute exercise typically is what starts this particular cascade. So increases in blood flow create vascular shear force. L-arginine gets oxidized to L-citrulline as well as nitric oxide by NADPH in the presence of oxygen. This nitric oxide then diffuses into vascular smooth muscle of the tunica media and binds to guanylate cyclase, resulting in increased cyclic guanosine monophosphate or cGMP activity and corresponding reduced intracellular calcium concentration. Subsequent single transduction cascade ultimately results in smooth muscle relaxation and subsequent vasodilation. High concentration of arginase in the liver, so this may negatively affect the bioavailability when using L-arginine supplements. L-citrulline, however, bypasses hepatic metabolism as well as splanchnic extraction and otherwise pre-systemic elimination. So approximately 80% of L-citrulline gets catabolized to L-arginine by the cells in the proximal tubules of the kidneys. Based on these mechanisms, it's been proposed that L-citrulline may be more effective than L-arginine, mostly due to the bioavailability based on these physiologic mechanisms. So oxygen is required in the NO synthase dependent pathway. It's actually a reduction in oxygen actually is what starts the NO synthase independent pathway. So it's understood that salivary glands extract circulating nitrate, and then anaerobic oral bacteria reduce nitrate to nitrite. Salivary nitrite is then metabolized to nitric oxide by gastric acid, or it's absorbed into circulation as nitrite. Things to consider, so NO has a half-life of 3 to 4 seconds versus nitrate, which has a half-life of 5 hours. So it's going to be better to measure NO synthesis through plasma nitrate concentrations. Many of the different commercially available NO supplements have several ingredients beyond NO precursors that we're reviewing here. We must consider the precursors in isolation or basic combinations to first evaluate the effects and whether or not NO synthesis or these products increase NO synthesis and subsequent performance measures. Supplements related to the NO synthase dependent pathway, L-arginine, L-citrulline, versus the independent pathway, nitrate. L-arginine, so although muscle blood volume increases with 3 to 6 grams of L-arginine, this doesn't appear to be due to an increased NO production, as the same dose yielded no increase in plasma nitrate or nitrite. No significant improvements in strength occur with L-arginine supplementing 6 grams prior to exercise or after consuming 2 grams per day for a period of 2 weeks. However, there is evidence that consumption of 2 grams per day for 45 days may yield increased VO2 max in a male athletic population. When L-arginine is combined with other vitamins and amino acids, there's significant improvements in fatigue, oxygen consumption, as well as rating of perceived exertion during cycling and swimming tasks. However, none of these particular studies measured plasma nitrate or nitrite concentrations, so we can't necessarily attribute these improvements to an increased NO response. Strength, so in one study measured by the 1 rep max, improved with supplementing L-arginine alpha ketoglutarate or AAKG for 8 weeks, but not when taking it acutely prior to one bout of resistance training. When 6 grams of L-arginine is used in glycine arginine alpha ketoisocaproic acid or GACIC, greater power and retention of power were demonstrated in cycling type sprints. As long as the individual wasn't a trained cyclist, there was no effect if the individual was a trained cyclist. In resistance trained males, GACICs demonstrated improvements in lower body torque, sustained work, and strength. Again, none of these studies measured NO plasma biomarkers, so you run the risk here of, are these improvements coming from the arginine, or is it an augmentation from the other chemicals within that particular compound? So you can't necessarily attribute these results to an increased NO response. L-citrulline at 3 grams per day for 7 days, reduced rating perceived exertion, improved pedaling speed, and mean power output. These have all been recorded with cycling type tasks. And then similarly, a dosage of 2.4 grams per day resulted in improved cycling time after 7 days of supplementation. 6 grams per day, both L-arginine and L-citrulline yielded increased plasma biomarkers. However, L-citrulline was superior with VO2 response time and cycling tolerance. So with L-citrulline in the form of citrulline malate, a large meta-analysis and systematic review and meta-analysis revealed a small effect size. However, there was an effect with it as far as improving muscular strength and endurance measures for resistance and endurance trained males. Males and females, predominantly males, were used with this. And then although this systematic review and meta-analysis did not include measures for NO plasma biomarkers, in 2 other studies, 6 grams of citrulline malate resulted in increased plasma biomarkers, which obviously is less than the 8.2 grams reported in the systematic review and meta-analysis. Nitrate, so dietary nitrate can be obtained through lettuce, spinach, and beetroot. Based on 2 different systematic reviews and meta-analyses, nitrate supplementation resulted in improved time to exhaustion in well-trained and recreationally active subjects, but no effects on time trial or measures with the graded exercise test. The authors report a considerably variable range of nitrate dosing, so not real standardized as far as the dose, ranging from 4.1 to 19.5 millimoles per day. And nitrate does not appear to have an effect on muscular strength, but it does have an effect on peak power during the Wingate test. So back to our question, so should nitric oxide precursor supplements be used in resistance and endurance training to improve performance metrics? The answer is it depends. So with L-arginine, there's no real acute effects on strength, VO2 max, or power. However, low dose extended use, there may be improved VO2 max if using for greater than 30 days. And there's some evidence indicating an increased NO response with L-arginine. When L-arginine is combined, we see greater effects on strength when it's included in AAKG or GACIC, and then improved oxygen consumption and rating of perceived exertion when combined with other vitamins and amino acids. No report on actual NO production here for these particular studies. With L-citrulline, evidence primarily favors use for acute increases in cycling speed, power, and VO2 max. Most data suggests an increase in NO production. With L-citrulline combined, the greatest effects on muscular strength and power have been demonstrated with citrulline malate, and citrulline malate has the greatest evidence as far as an increase in NO production as measured by plasma biomarkers. Nitrate, so there's no evidence for muscular strength improvements with nitrate. Evidence predominantly favors use to improve time to exhaustion and power during cycling. Large variability in dosage, again 4.1 to 19.5 millimoles per day. Vast majority of research on NO supplementation has studied the effects on moderately trained and recreationally active males. In elite athletes, there's little evidence that supports the use of NO supplements and training in itself. That may be sufficient to really improve performance measures because various dietary and current training conditions are so regimented, likely those NO supplements are going to have a very small or negligible effect for that particular population. For the untrained individual, there's little available evidence for NO supplementation. Again, most of the research has been conducted on moderately trained and recreationally active males. Although there's evidence supporting improved performance metrics in certain populations as previously discussed, only a few studies measured and reported plasma biomarkers of NO production. So if the goal of NO supplementation is to improve performance measures by increasing NO production, these biomarkers should certainly be measured in all studies. Without these measurements, we can't necessarily attribute performance to the actual NO response if the biomarkers were not measured. Thank you very much. If you have any questions, please don't hesitate to send me an email.